Hello, everyone, and welcome to this audio podcast as part of this intermission, the Labonix intermission. This is the Shientist, and this is another Storm Robotics production. Today, I'm going to provide an overview surrounding principles and values in health promotion and the role of early intervention and health promotion in the management of chronic liver disease. So, in context of an excerpt, I thought to provide an overview around this works, and the aims around this work was to highlight the role of early intervention and health promotion in the management of chronic liver disease. The objective around this was to present a critical analysis of a health promotion, a health promotion issue and apply principles of health promotion and ethical theories to the health promotion practice of this subject, and gain an understanding of how patients and professionals can form partnerships to inform best practice through health promotion and management of chronic liver disease. Now, the literature around this was that liver involvement was often observed as a manifestation in something known as a polycystic liver disease in context of chronic liver disease. The risk factors of hepatic cysts development were identified and were observed, and was observed in has been observed in literature that hepatic functions or function is is uh, is unaffected in polycystic liver disease. However, chronic liver disease often was associated with or has been associated with a decline in health-related quality of life, anxiety, and where there was evidence of depression. Moreover, alcohol consumption remains associated with the development of chronic liver disease. CLD, chronic liver disease patients, including those who fall into the category of particular nephrology, and also in aligned to particular forms of chronic kidney disease. So in this context, autosomal dominant polycystic kidney disease patients are at increased risk of developing or potentially developing symptoms that are aligned to chronic liver disease, in more so than in other particular healthcare conditions. Now, early recognition and quick intervention are an essential step in chronic liver disease management. And the discussion around this works was that alcohol and non-alcohol sufferers of chronic liver disease have the same priority in context of liver transplantation. However, alcohol addicted patients with chronic liver disease should first get alcohol addicted patients with chronic liver disease are prompted by professionals in by health professionals to approach particular areas in aligned to public health. So, for example, where there may be evidence of CLD or chronic liver disease, then patients should seek to approach healthcare services between, for example, primary and healthcare sectors that deal with aspects of alcoholic and non-alcoholic sort of services in where there may be evidence of potential liver disease, liver issues, and in those who have evidence of polycystic liver disease, PLD patients meet many limitations in sort of care plans, healthcare plans, and within line to treatment. And the major limitation is the availability of particular therapeutic options. Therefore, liver transplantation is perhaps one of the only available therapeutic options, wherein, for example, after where there has been liver damage and gone past a particular threshold in context of liver function. In regards to the sort of limitations, therapeutic limitations, liver transplantation is and would be the only option where for example, liver function has been particularly damaged. And then, however, in line to this, however, treatment with particular somatostatin analogs have shown visible or viable results in relating to total liver volume, or TLV. And the conclusion around this was that researchers, investigators have informed that early diagnosis and screening is essential to prevent further complications. Understanding chronic liver disease and hepatic cysts and pathophysiology can help identify appropriate treatment and the management of the disease. However, data also suggests that there is a need for collaborative efforts around this as well. So main terminologies that align to this work include chronic liver disease, polycystic liver disease, health-related quality of life, and also health promotion. So here I just thought to highlight a slide in regards to acknowledgements. So this works had a collaborative there was a collaborative effort aligned to an academic collaboration and a collaboration aligned to the Renal Patient Support Group, RPSG. Once again, this was another Storm Labonix production.